Thank you. All right, Madam Clerk.
Presentation of a proclamation recognizing World Stroke Day 2017.
Okay. Will those, Mr. Stillman and any others who are joining me? Thank you.
Can you make it?
So let's stand this way. Well, first of all, joining me, we have Alan Stillman, welcome, and Ann Harbour from Inova, and also a member of the Public Health Commission, and Katja Wanzer, the chair of the Public Health Commission. And thank you all for being with us here tonight. And I want to say special thanks to Mr. Stillman for bringing this forward. And we'll talk in a moment, and we'll have each of you say a few words. I'm going to first read the proclamation, and we will talk in a moment about it. Whereas 1 in 6 people will have a stroke in their lifetime, 1 in 4 strokes is fatal. 80% of families are affected by the disease. Strokes are a leading cause of death and disability that devastates individuals and families in our communities. And whereas there are life-saving treatments that must be administered within 3 or 4 hours once symptoms begin, but less than 10% of patients get to a hospital within this time due to the vast majority of people not knowing how to spot a stroke and the importance of calling 911 when symptoms are recognized. And whereas Alan Stillman, a 30-year resident of Alexandria, who lost his grandmother, Rose, to a stroke, and subsequently his devastated mother, Helen, as well, has started a Spot-a-Stroke, Stop-a-Stroke, Save a Life campaign to raise stroke awareness among the citizens of Alexandria. And whereas the City of Alexandria is committed to educating city employees, including but not limited to the Health Department, the Fire Department, and Community and Human Services Department, about how to spot a stroke. And whereas as a primary stroke center, Inova Alexandria Hospital was one of the first hospitals in the Washington, D.C. metropolitan area to receive the Joint Commission's Gold Seal of Approval for stroke care and was awarded the Gold Plus Award for Outstanding Specialized Stroke Treatment by the American Heart Association and the American Stroke Association. The hospital's Get With the Guidelines designation indicates that its stroke assessment and services provide patients with the best chance of survival. And whereas the Alexandria public and private schools will be encouraged to make Spot-a-Stroke, Stop-a-Stroke, Save a Life part of their training to all their students, and whereas all Alexandria health-focused entities, including hospitals, clinics, doctors, pharmacies, coalitions, etc., will be urged to participate in improving the city's stroke literacy. And whereas, in addition, the greater Alexandria community, including businesses, civic associations, senior services, houses of worship, and inhabitants, will be encouraged to participate and contribute to the Spot-a-Stroke, Stop-a-Stroke, and Save a Life campaign through active citizenship efforts. And whereas the goal is to educate everyone in the city of Alexandria about stroke, and therefore reducing the onset to 911 time, to be measured by the Alexandria Fire Department. And whereas the Spot-a-Stroke, Stop-a-Stroke, Save a Life campaign will make Alexandria a model for other communities, cities, counties, states, and the nation. Now, therefore, I, Allison Silberberg, Mayor of the City of Alexandria, Virginia, and on behalf of the Alexandria City Council in support of upcoming World Stroke Day 2017, do hereby proclaim October 10th, 2017 as Stroke Smart City, in witness whereof I have hereunto set my hand and caused the seal of the City of Alexandria to be affixed this 10th day of October 2017. So I want to present this to Mr. Stillman with my gratitude on a personal level as well as on behalf of the council and the city, for bringing this forward. When Mr. Stillman reached out to me, we had a heart-to-heart talk about his grandmother and about your mom, and it is heartbreaking. And many of you might know that my mother had a series of strokes. And it is not what ended her life, but I can tell you that everyone in my family knows how to spot a stroke. But at the time of the original stroke, we did not know, and my parents did not know. And we were able to access great care, medical care, and rehabilitation care. My mother made a great recovery, but it was extremely difficult on her, on my father, on everyone. But my mother was very courageous, but it was tremendous hard work. And it cost a lot of medical care resources, and et cetera. And so what we want to do together, which I'm so delighted, this is the idea of becoming a stroke smart city, and that other cities can do this, other regions and throughout the country. And the sooner you catch a stroke, the sooner you can get care and help and hopefully stem the tide of any destruction to one system. And so with that, I'm honored to introduce Mr. Stillman.
Thank you. First, let me just say, my name is Alan Stillman, and it's wonderful to see all of you here for the Mayor's Proclamation. As you know, strokes exact a heavy toll on individuals and families. 1 in 6 people will have a stroke in their lifetime. If you do that math on a city of 150,000, that means 25,000 Alexandrians in their lifetime will have a stroke. Roughly 6,000 will die. I know the human cost of stroke from losing my grandmother at 13, and it affected the rest of my family in a pretty devastating way. This is the reason that I'm starting this public health campaign to educate ideally every citizen of Alexandria on how to spot a stroke. I'm really grateful for the mayor's support in proclaiming Alexandria a stroke-smart city. I'm excited to work with our public health agency, our hospitals, our schools, civic associations, senior organizations, every constituency that's committed to making us a healthier city. I'm eager to work with Alexandria Fire and EMS to actually track the progress and be able to measure it. And together, I believe we can save many Alexandrian lives and become a model for other cities. I want to, again, just thank Mayor Silberberg for her leadership and the rest of the City Council for their support. And I look forward to Alexandria being a leader in Spot a Stroke, Stop a Stroke, Save a Life. I look forward to reporting back to you in the future of the progress our city makes.
Thank you. Okay, just stay right here. And we have Ann Harbour and Katya Wanzer, if you just on behalf of the Public Health Commission.
Well, thank you, Mayor Silberberg, for recognizing how very important and timely this issue is, especially as the population ages. And Alan, for your tireless work. He really has talked to everybody you need to. And just the commission really looks forward to watching the campaign develop. I think it's very targeted, very dynamic, and we look forward to seeing the analytics as they come out. So thank you so much for involving us.
On behalf of Inova Alexandria Hospital, we're just grateful for our community leaders and the mayor for making this an opportunity to spread education within our community on stroke education.
Absolutely. And if you think about it, it's often might be a grandparent with a grandchild, and if you know how to, with a fire, to stop and roll on the ground, and if we can teach our children at a pretty young age to do that, we can teach them the simple signs about a stroke and perhaps help them with their grandparent. They just have to call 911. So with that, thank you so much, and we look forward to working together. Thank you. Thank you so much. Thanks. Thanks. All right. All right. Well, do we have a motion to? Moved by Councilwoman Pepper. Seconded by Councilman Smedberg. Any discussion? Hearing none. All those in favor say aye.
Aye.
Those opposed? The ayes have it. Thank you. Thank you all. And I know that Mr. Stillman's also been in touch with Dr. Herring, our medical director for the city, and the fire department, and the schools. He's everywhere. So that's great. Thank you. All right, Madam Clerk.
Presentation of a proclamation recognizing October as National Bully Prevention Month.